My name is David Plume. I'm a GP in Norfolk and I'm Macmillan's lead GP for cancer and end of life for East Anglia. When I see someone who's got signs or symptoms suggestive of cancer, I'll be looking at referring them off to the specialist at the hospital for further tests and investigations. This is often going to be under what we call a 2-week wait, which means that they get seen very quickly and the appropriate investigations and tests get done by the specialist at the hospital. We won't necessarily get those investigations and tests back because they've been done by the specialists, but we'll get a letter back from the hospital to tell us either that the tests and investigations were fine, or in unfortunate cases where people are diagnosed with cancer, to tell us that the investigations and tests weren't okay and that the case is then going to be discussed by the multidisciplinary team at a point in the short future. The length of time needed for these investigations can differ depending on the type of investigation. Some things like blood tests are very simple and can be done in a couple of minutes. Scans, for example, a CT scan might take 30 to 40 minutes, an MRI scan might take 40 to 50 minutes, and other investigations such as bronchoscopies or colonoscopies can require general or local anaesthetic or sedation and can take anything up to an hour or so to do. In some clinics, there is what's called a one-stop shop, which is offered, where investigations and tests may well be done on the same day. In other specialties, investigations and tests may be done over a more protracted period of time of a couple of days or a couple of weeks in order to reach a diagnosis. The period of time between being referred up to the hospital under the 2-week wait and being seen and a diagnosis being made could be 2 weeks, or it could be a little bit longer depending on when the investigations happen. We know that this waiting around and this waiting for a diagnosis can be really, really distressing and difficult for people. What we would suggest is, in the first instance, is that you don't worry. Just because you've been referred up under a 2-week wait doesn't necessarily mean that you have a diagnosis of cancer. Inevitably, however, you're going to worry that you do have a diagnosis of cancer. And so the things to do in the meantime would be to seek support from friends and relatives, maybe see your GP again to get some support and allow your GP to talk you through the process and what's happening, or maybe to seek external sources of support, such as from the Macmillan helpline and things like that. Once you've had the investigations and tests, the specialist doctors will call you back to the hospital for an appointment to discuss the results. They will have already discussed the results within the multidisciplinary team meeting, and so we'll have a very good idea of what type of cancer that you may have, and also what the potential treatment options might be. Unfortunately, it takes a period of time between having the investigations, having the discussion with the multidisciplinary team, and the specialist doctors being able to give you the diagnosis. But they will offer you an appointment to come in and have a talk to them about the diagnosis, and they'll be able to run you through both the diagnosis and also the treatment options that exist. We do know that this is a really difficult time for people, and having had the investigations and tests, you want nothing more than to get the results as soon as possible. But the specialist doctors will see you as quickly as they possibly can and put your mind at rest, hopefully. If the diagnosis is not good and it is found that you do have cancer, the oncologist may want to run some other tests and investigations to look at the cancer in more specific detail to help them with the treatment options. But what they will do is discuss with you the treatment options that are available, and these might involve medical treatment with chemotherapy or drugs, radiation treatment with radiotherapy, and or some surgical treatment, either to remove the tumour, either partially or completely. As GPs, we have a lot to offer at this point. It's completely appropriate for you to come in and talk things through with us at this point. And it may be just that you want a friendly face and a sounding board to discuss ideas and worries and to talk through the treatment that you've received at the hospital or advice that you've received at the hospital. It may be that you require some more information about your diagnosis or to validate some of the information that you've already received. Your oncologist might offer you the opportunity of taking part in a clinical trial. And this can often be quite a daunting prospect for people because they're worried about what being in a trial means and whether that means they're not going to get some treatment for their cancer. It's completely appropriate to discuss that with your oncologist or come and discuss it with your GP, who can put your mind at rest and talk you through the specifics of being in a clinical trial and what the implications of that might have for you and your treatment. No matter how much you might have prepared yourself for the possibility that you might have cancer, when you're told that you have cancer, all logic goes out of the window and you can often forget to ask questions that latterly seem to be really, really sensible, and things that your friends and family say, did you ask this, did you ask that, go completely out of your head. I think the key thing to remember is that there's no such thing as a silly question. And what I would encourage is you to go and see your GP, ask those silly questions in inverted commas, because your GP is there to support you, help you. And if they don't know the answer to the question, they can send you off to see someone who does.
For information, help, or if you just want to chat, call the Macmillan Support line on 0808 808 0000 or visit macmillan.org.uk.